In this session, we are discussing about the bone ulna. We know that ulna is a medial bone of the forearm. Medial bone, the lateral bone we discussed it in the last class, that is radius. This is the lateral bone, that is radius. Just opposite to this, here we have the medial bone. So ulna is the medial bone of the forearm. Okay, ulna is the medial bone of the forearm, and it is homologous to the fibula. While discussing radius, I told you that radius is homologous to the tibia, that is present in the lower limb. Likewise, the ulna is homologous to the fibula, that is present in the lower limb. Okay, so 2 point. Ulna is a medial bone of the forearm, and it is homologous with the fibula. 2 point I completed. As usual, we are moving to the side determination, then the features of upper end, then the features of shaft, and then the features of lower end. This is the major thing we are discussing in this session. So let's discuss about the side determination in detail in first session. So in side determination, in order to understand the side of ulna, we are discussing the side determination. So the first one is upper end. The upper end of ulna, this is the region. This region is the upper end. So the upper end of ulna is hook-like. See in this picture, this first one is anterior view and second one is a posterior view. And just go through the upper end. The upper end is somewhat a hook-like. The shape is like a hook. And the concavity, see here the concavity is directed upward. Why the concavity is directed upward? We know that the humerus bone is attaching to the ulna. So in order to the trochlear portion, in order to attach to the trochlear portion of ulna, there is a concavity. So the concavity is directed upward. So the first point, that is upper end. Upper end is somewhat hook-like shape and the concavity is directed upward. And the second one, that is the lateral border. See, this is the lateral border. Mean that I marked here, that is introsus or lateral border. The lateral border is very sharp. Lateral border is very sharp and it is crust-like. Okay, the lateral border is very sharp and it is crust-like. And the third point while discussing the side determination is, that is the lower end. This is the lower end. Okay, this region is lower end. The most important point that is related to the lower end is the styloid process. Okay, the most important point that is related to the lower end is the styloid process. So 3 point. First one is upper end. Upper end is hook-like and the concavity is directed upward. And the second one is lateral border or the introsus border is very sharp. And the third one is lower end. There we have the styloid process. This is about the side determination. So side determination completed. So let's move into the upper end. Okay. So what is the features of upper end? The main features of upper end are olecranon process, then the trochlear notch. Here we have the coronoid process, then the radial notch. These 4 important things we want to discuss. Okay, olecranon process, then the second one is coronoid process, third one is the trochlear notch, and fourth one is the radial notch. These 4 important points we want to discuss while discussing upper end. So let's discuss one by one in detail. This is very important. Olecranon coronoid process is very important. That is related to the ulna. So the olecranon process means it is project upward from the shaft. See, this is the shaft. This is the shaft. Okay, this region is the shaft. And the olecranon process is projecting upward. See, from the shaft it is projecting upward. The olecranon process is projecting upward from the shaft. And for the olecranon process, it has anterior surface. Okay, first surface is anterior. Second is posterior surface, then the medial surface, then lateral surface and supinator surface. 5 surface for the our olecranon process. Anterior, posterior, medial, lateral and the superior surface. First one is anterior surface. Okay, anterior surface means anterior surface of the olecranon process is articular. So what's the point? Anterior process of the olecranon process is articular. That means it is taking a part in articulation. So it is the upper part of trochlear notch. See, here we have the trochlear notch. This 2 is the trochlear notch. The upper part of the trochlear notch is the anterior surface. Okay. So the anterior surface is articular or it is taking part in articulation, and we want to understand that it is the upper part of the trochlear notch. And the second one is posterior surface. Okay. The posterior surface is separated from the, see, this is the posterior surface. See, I marked here also the posterior surface. Sorry, not this one. The posterior surface, we want to understand that. Here it will come. The posterior surface is separated from the skin. The posterior surface of the olecranon process is separated from the skin by a bursa. It is separated from the skin by a bursa. and inferiorly continues the posterior border. See, here we have the olecranon process and it is continuing with the posterior border. This border is a posterior border. So it inferiorly continues with the posterior border and its upper part from point of elbow. This point of elbow is formed by the, what we say, this point of elbow is formed by the our so this point of elbow is formed by the posterior surface. So the features of posterior surface are, it is separated from the skin by a bursa, that is the first point. Then inferiorly it is continuous with the posterior border and its upper part from the point of elbow. Then the medial surface of olecranon process. The medial surface means it is continuous to the medial surface of shaft. Okay, this is a medial surface. MS means medial surface of shaft. So the olecranon process medial surface is continuous with the medial surface of the shaft. The lateral surface of olecranon process is continuous with the posterior. This is the lateral one, and this region is continuous with the posterior surface of shaft. And superior surface, it is a roughened area. So this is the important feature we want to understand from the olecranon process. It has anterior surface, what we say, posterior surface, medial surface, lateral surface, and superior surface. Okay, so features, main two features completed, side determination completed, and apparent olecranon process completed. Now we are moving to the coronode process. The coronode mean it is derived from a Greek word meaning cross beak. Okay, so the meaning of that word coronode is cross beak. And just go through this picture also. Okay, I will discuss it later. And just go through this picture also. It is representing the upper end. Okay, this one is olecranon process that we completed. Now we are discussing the coronode process. The coronode process have superior surface, anterior surface, and the lateral surface. The superior surface of the coronode process means it is a lower part of trochlear notch. See, this is the trochlear notch, and just below this we have the coronode process. So it is the lowest part of superior surface of the coronode process means it is the lowest part of trochlear notch. It is the lowest part of the trochlear notch. The anterior surface means it forms the ulnar tuberosity. See, here we have the ulnar tuberosity. This one is the ulnar tuberosity. The ulnar tuberosity is formed by the, what we say, the anterior surface of the coronode process. And the lateral surface of the coronode process, here just go through this picture. Okay, importance of this picture is coming. In the lateral surface, the upper part we have the radial notch and the lower part we have the supinator crest. S crest means it is supinator crest. Okay, so superior surface we told that it is the lowest part of trochlear notch. Then the anterior surface, it is forming the ulnar tuberosity, and the lateral surface we have the upper part radial notch and the lower part the supinator crest. So coronode process completed. Then the third point, that is trochlear notch. Trochlear notch, we know that there is a trochlea that is present in the lower end of humerus. We have capitulum and what we say trochlea that we discussed while taking the humerus. I told you in detail there. So the trochlea of the humerus is attaching to the ulna through the trochlear notch. So the articulation is taking place there. And the last one is radial notch. Radial notch means in the upper end we know that there is superior radioulnar joint, and in the lower end we have the inferior radioulnar joint. So the superior radioulnar joint is formed by because of the radial notch. That is it articulates with the head of the radius and forming the superior radioulnar joint. So this is an important point that we want to understand from the upper end. First one is olecranon process, second one is coronode process, third one is trochlear notch, and the fourth one is the radial notch. These four important points we want to know. Okay, it's completed. Then we are moving to the shaft region. For shaft we have surfaces and we have borders. So the major borders of shaft are this one. This is the introitious or lateral border. In case of radius we know that the medial border is introitious. Okay. In here in ulna, which is what we say lateral border is introitious, and we have anterior border. This is anterior border, and we have a posterior border. This one is from the olecranon process ending to the styloid process. We have the what we say the posterior border also. So the three borders, introitious or lateral border. Here we have the anterior, from the ulnar tuberosity to the styloid process. We have the anterior border, and the posterior process from the olecranon process to the styloid process. We have the posterior border. So three border. And the surfaces mean first one is anterior surface. See, this is the anterior surface. Anterior surface mean it is between anterior border. See, this is the anterior border and this is the lateral border. So in between the anterior and lateral border, we have the anterior surface, and the nutrient foramen is seen on that region. And the second one is medial surface. Medial surface means this is the medial surface of shaft. So it is present in between anterior border and the posterior border. In between the anterior and the posterior border we can see the medial surface. And lastly the posterior surface. Posterior surface means it is present in between the posterior border and the lateral border. This is the posterior surface. It is present in between the posterior border and the lateral border. Okay, posterior border and the lateral border. These are the important points that is related to the shaft. Shaft have 3 borders and 3 surfaces. Then we are moving to the lower end. Lower end there is 2 important points. First one is inferior radio-ulnar joint and second one is styloid process. The most important point is styloid process that is present in the lower end. Along with that, we told that here in the upper end due to the radial notch we have the superior radio-ulnar joint is coming. In the styloid process we have, in the lower end we have some attachment or notch that is for the attachment with the radial bone and it is forming the inferior radio-ulnar joint. So this is the in detail about this session. Firstly side determination, then the features of upper end, that is olecranon, then coronoid, trochlear and radial notch, then shaft, 3 borders and 3 surfaces, and the lower end we discussed in detail. These are the important points we want to know from this session. Okay.